Hello everybody, this is Gary. Today is March 29th, 2022. It is 2 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia vlog entry for today. Today I'm doing pretty good. My delusions and paranoia are not that bad today. My depression isn't that severe. My auditory hallucinations are at a bare minimum. They're always there to some extent. I always hear voices telling me that people are following me, they're spying on me, laughing at me, that kind of thing. Some days are worse than others. I usually take Zyproxil when I have bad delusions or bad hallucinations, and I usually take it with Klonopin to help deal with the anxiety. But my paranoia and my hallucinations are not that bad right now. My anxiety levels are pretty high. I had an MRI done on my right knee last week on Thursday. I got the test results, and my primary care provider also got the test results. I have a torn meniscus in my knee as well as a fracture in my femur inside my knee, and there's some other tissue damage. There's some tears in the ligaments and things like that. I'll probably need surgery on my right knee. My right knee has been bothering me for 3 or 4 months. I twisted my knee on the bus, and I had gone to urgent care at St. Mary's Hospital here in Rochester, New York. They did an x-ray, and that didn't show anything wrong, but my knee had been bothering me for quite some time, so I had to insist with my primary care doctor that we get an MRI done to my knee, my right knee, and I had to wait 3 weeks before the MRI could be scheduled. So I finally had it done last week, and I definitely have damage to my right knee. The pain is real, the damage is real, so it looks like surgery is probably going to be necessary. I'm not exactly sure how the surgeon is going to approach this. I'm not seeing the surgeon until next Tuesday, which I believe is the 4th or the 5th of April. Tomorrow is the 30th. So I will find out from the surgeon what he wants to do next week. But it looks like surgery is definitely going to be necessary because my right knee is really fucked up. It's difficult to deal with schizophrenia and its symptoms as is. It's just makes it more difficult to deal with my schizophrenic symptoms when I have a lot of medical problems. I've already had surgery twice in the past 12 months. I've had prostate surgery and surgery on my urinary bladder for difficulty urinating. Going into surgery is never fun. I mean, I suppose it could be worse. It could be something more serious, like a heart problem or something like that. But still, having any severe pain, medical problems, makes it more difficult for me to deal with my psychiatric symptoms, whether it's my depression, my anxiety, my insomnia, my paranoia, my hallucinations. My auditory hallucinations are not that severe today. They're always there to some extent. They're always telling me that people are following me, spying on me, laughing at me, or talking about me. But that's very low-key today. The paranoia is pretty low-key. I just have a lot of anxiety surrounding my knee, the potential for surgery, being less mobile for a couple of weeks, recovering from surgery. I'm not even sure what kind of surgery we're even going to do yet. I'm not an orthopedic doctor. I'm not an orthopedic surgeon. I'm not exactly sure what we're going to have to do or what the surgeon wants to do. But it looks like surgery is definitely going to be necessary. The rest of the pain that I've been having in my body is much less severe since I started Cymbalta about 6 weeks ago. I started taking Cymbalta not just for the pain in my right knee, but I was having pain throughout my body, musculoskeletal pain, nerve pain, joint pain, arthritis pain, and it was all over my body. and Cymbalta has helped me control that. And I'm also taking Neurontin, Tylenol, Flexeril, and Aleve for physical pain, joint pain, that kind of thing. The inflammation in my right knee, I take Aleve for. So I'm trying to cope with my schizophrenic symptoms as always, trying to stick to my daily schedule. I haven't made a video in a few days. I've been really busy with different things. There was repairs that had to be done in my bathroom by the maintenance people. I got distracted doing other things. That's why I haven't made a video, and I really haven't been sticking to my daily schedule over the past 3 or 4 days. But I've already spent an hour on the exercise bike today. I'm making this video. I already did some work on my computer. I'm trying to stick to my daily schedule because it helps me deal with my schizophrenic symptoms, as well as my medical problems. It just gives me a sense of normalcy to be able to stick to a daily schedule and a daily structure, with some flexibility, of course. When things come up, I'm not always able to keep up my full daily schedule. I'm seeing my psychotherapist tomorrow. I was supposed to go to group therapy tomorrow, starting tomorrow for the next 8 weeks, but because I'm probably going to need surgery on my knee, I'm not going to be going to group therapy. I will be continuing to see my psychotherapist, but if you miss more than 2 days in group therapy, they kick you out of the group anyways, and I don't think I'm going to be able to stick to that rule, so I just withdrew from group therapy for now because of the probability that I'm going to need surgery, and the surgery is going to make me miss more than 2 groups anyway, so there's no point in starting group. The group will cycle around again in a couple of months, and maybe I'll be able to go back to group. But I'm seeing my psychotherapist tomorrow. She's aware of everything that's going on. I talked to her briefly on the telephone. I'm assuming my psychiatrist knows about it, but I'll send him a message about my knee as well. But other than that, there's nothing to report for now. Like, share, comment, subscribe.